breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
Guys, welcome back to this week's episode of Brainstorming with Dr. Harrison and Dr. Kolby Condos. In this week and the weeks following, we are going to do something a little bit unique, and we're going to break down common health conditions. We're going to tell you what those conditions look like, what some of the symptoms may be. That'll be 1 week. The next week we will lead into what are some of the ways that you can diagnose this condition and what are some of the lab workups that you can use or examination techniques that you can use to find these symptoms. And then lastly, we're going to go a little bit through what the treatment of these conditions is going to look like, whether that's from traditional Western medicine, functional medicine, or even exercise and things like that. So to get started, we are going to break down the thyroid. We chose this because over 20 million people yearly are diagnosed with thyroid disease. And that's just the ones that get diagnosed, using the rough three test panels that most providers use to diagnose thyroid. So without further ado, let's get this thing rolling. How are you, man?
I'm doing great, Dr. Kolby. How was your day?
It's good. It's super, super busy. This talk we decided to go into today is going to be all the more relevant because one of my patients today came in with feelings of like fatigue and chronic illness, weight gain, hair loss, all these classic markers of thyroid. So I'm really excited to not only break this down with you, but then also to put this material together so that she can use it.
That's great. So I guess we'll just jump into, some people, they saw this podcast or they're listening to it, watching it, whatever they're doing, they're probably wondering, well, maybe some of them not really know where the thyroid is on the body, what its function is, how important it is. I call it the drill sergeant. Maybe dive right into that first. What is the thyroid? What does it do for us and why do we need it?
Yeah, so the thyroid is a gland. Sits roughly right here in your neck. Actually, it's in the shape of a butterfly, kind of. And actually, I think the word thyroid comes from the Latin's meaning of shield, I think is because it's shaped kind of like a shield like this. So that's super interesting. But the thyroid is really the master regulator. It helps to dictate a lot of our basal metabolic rates, or like the lowest baseline of energy expenditure that our body exhibits. And really the thing that we need to understand that's important is that you're pretty much every single cell in your entire body has a receptor for thyroid hormone. So if your thyroid is all out of whack, the rest of your body is going to be out of whack too. Do you want to go ahead and spitball off that with me?
That's kind of the way I explain it when I'm teaching about the thyroid. I always say your body could want to work. Everything in your body is ready to go, and they're waiting for direction. They're waiting for orders from the drill sergeant. So the thyroid is like this drill sergeant. It can turn everything on in the body or turn everything off in the body. And as you said, there's thyroid receptors on every cell in the body, which makes the thyroid somewhat unique because it can influence every tissue in the body. If it can influence every tissue in the body, when it becomes problematic, when there's a disorder with the thyroid, when the thyroid isn't working properly, it can affect every tissue in the body, which is extremely troubling. Some of these symptoms, as you mentioned, that case was the weight gain. Weight gain is a symptom of many things, but the thyroid can be one of them because metabolism slows down, and that includes fat burning. Weight gain, hair loss, hair thinning. Usually you see more hair in your brushes, in the shower. Cold sensation, so inability to handle lower temperatures, cold hands, cold feet, the most common things that I see. Skin disorders, dry skin. So to understand the symptoms of thyroid, just think of the body slowing down because over 95% of all thyroid disorders are low thyroid, where the thyroid's functioning too slowly. I always say hypo means low thyroid. And if everything is slowing down in the body, all metabolic processes are slowing down in the body, like, fat burning, hair growth slows down, heart rate can slow down, cold intolerance. I'm trying to think of some of the other ones. Another one that I see, and I even have it on my paperwork, and I don't know if you do, Dr. Kolby, but that outer 1/3 of eyebrows losing them. It's not everybody, but it's pretty common. I even see eyesight start to change. So vision progressively getting worse, where you're upgrading your prescriptions, a lot more consistent consistently in the last maybe 1 to 3 years. I also see bowel difficulty. I'll see where people become a little bit more constipated with low thyroid function, just because when you eat food, digestion is not running at the speed, so food moves slower through the body, and there's a lot more constipation. But then it can be followed up with more diarrhea because everything is backed up, and then there's a bowel movement, and then it's like it's diarrhea. So those are some of the ones. What do you see, Dr. Kolby, because you're always in the world of neuro, what do you see with neurological processing, thought, and concentration?
Yeah, like you said, it slows down everything, right? So then they have a lot of what they perceive as, brain fog or fatigue, or I've had patients that have anxiety. I think that it's important to kind of set the bar a little bit. And I mean, you're going to have varying severity of symptoms. I had a guy, and normally it's a disease that affects mostly females, not always, but for the majority of the prevalence is in the females. But the guy came in, he'd been kind of, kicked down the road. Everyone's like, whatever. He's just got anxiety. He's got depression. Well, when I ran his lab markers, they were like 4 or 5 times what they should have been. And it wasn't just one. It was the ones that, makes you a little bit nervous. And he presented with the classic stuff where you just kind of go, he's got chronic fatigue syndrome or whatever, but he was tired. He was sluggish. He felt like he was wading through mud all the time is one of the symptoms that he described. And then he's like, and I feel like my reaction times are slow and I feel depressed. So I think that it's important, and you've done a really good job breaking down a lot of the symptoms that you see in the clinic or in your office. But I mean, anything, whenever someone comes in and they're like, I don't know, all of a sudden I just have this weird thing. I'm like, I'm going to check your thyroid. Well, I just had it checked. Well, I'm going to check it again, because your thyroid is regulated on an instant to instant basis. It's not, you don't run the lab one time and then it's fine. That just means that it was fine at that particular moment. And then you have to kind of reevaluate. So anytime I get something weird, I always just make the assumption or just want to double check and make sure that the thyroid is functioning the way that it should, because a lot of the weird stuff can be maybe not completely contributed, but it could be a concomitant to a thyroid disease.
Exactly. If you have this drill sergeant and everything starts slowing down in the body, because we usually see more hypothyroidism, low thyroid, than high thyroid. Naturally, the thyroid has to be ruled out. But this isn't the session to talk about diagnostic testing and laboratory tests. But as you said, the thyroid, it changes in real time. So it upregulates or downregulates depending on the metabolic demand. So if you're running and all of this stuff, or a lot of emotional stress, there's more demand for thyroid hormone. And the thyroid has to upregulate its production of hormone at that given time, depending on the demands. That's kind of what you were saying, right, Dr. Kolby?
Yeah, absolutely. It's just basically like a fuel delivery system in a way. If you need more gas and you push on your gas pedal, it's going to supply the fuel for that. So yeah, I mean, it's an instant to instant basis. So when people say, my thyroid's good, well, it might have been at that specific moment.
Exactly. And so there's the stimulation to the thyroid, or meaning the thyroid is performing more one time, less at another time, more at another time. And depending on where you take that picture, and the problem with the conventional model, which with regards to testing, which again, we're not going to go into testing today, that's a whole session. That'll be next time. But if people are being tested, and this is why things get missed, one of the reasons why things get missed is that they're being tested. They're on the thyroid medication and they're being checked every 6 months or every 4 months. Oh my goodness. They could have hit the high spot or the low spot that day, because there's an up and down even throughout the day. So, people might have said, well, my thyroid was in the clear before, but I'm still struggling. It could be just the way it was tested. In my office now, what we're testing with people, once we make changes and do what we need to do, we're testing every 2 to 4 weeks to follow it, to make sure that, where the trends are. I know some docs that are testing every week, this one marker. So don't want to tie up into the weeds. So I talked about what more hypothyroid symptoms are like. What about the other side of the spectrum? What do you see with hyperthyroidism?
So hyperthyroidism, obviously a lot less clinically common. I have yet to see anyone who comes in with a true hyperthyroidism, but you can develop like Graves' disease, which is where you produce too much thyroid hormone, or you can develop like a pituitary gland tumor, which produces too much thyroid stimulating hormone, which again, we'll kind of go through those a little bit more in depth. We go through the laboratory analysis of the thyroid. But people that come in with this is, heat intolerance. They're really, really, really skinny, thin. Their skin is warm and dry. They're very nervous, anxious. They have heart palpitations. They're sweating all the time. So it's like you said, if it's, dictating the basal metabolic rate of whatever, and you're giving it too much, then it's going to be overstimulated. You think about, someone who's overstimulated, they're sweating, they're nervous, they're very thin, and and their hair, they grow hair weird in weird spots.
Coarse, and it's almost like coarser hair, even jawline. Females, that can be another hormone problem. But what cases, have you seen a case recently of hyperthyroidism?
I haven't. I guess I didn't see one of true hyperthyroidism, but I did have a case with a patient who had a condition called Hashimoto's, which is where you develop antibodies to your thyroid, and your immune system actually causes like destruction of the tissue, depending on which antibody it is. But this particular patient, when you have Hashimoto's, you can actually get swings between hyper and hypothyroidism. So she was getting these basically irregular periods where she was like, I feel really, really good. I have tons of energy and I feel like I'm kicking butt. And then I slide down into like this depression, foggy fatigue, and it lasts there forever. My hair starts falling out and then it swings back up. And basically what was happening to her was she had gotten the flu, and her immune system spikes, so the production of the antibodies to her thyroid naturally increased. And she actually caused her to cause hypothyroidism. Well, then she kind of had rebound symptoms once her immune system had kind of chilled out, because her TSH had produced so much thyroid hormone that it swung her into hyperthyroidism. So when I actually did the labs on her, she was clinically diagnosed, like you could have diagnosed her clinically with hyperthyroidism. But I knew that wasn't truly the case because I tested her 6 weeks prior to that and she was hypothyroidism. Oh. So I think that's another part that a lot of people don't really understand or look into, is that you can be both depending on if it's a true case of hypothyroidism, hyperthyroidism, or an autoimmune condition like Hashimoto's.
I think you just let the cat out of the bag on this one here. I was waiting for this in our conversation. So to summarize for people, because the symptoms are very vast. I talked about low thyroid symptom, hypothyroidism, where everything slows down, low. That's how you have to remember it. And every metabolic process in the body slows. Hair growth slows down. Again, weight, leaning out, burning fat, that slows down. Energy, of course. Irregular sleep patterns, infertility, even wound healing. I know a lot of people with cuts and injuries, if they have a slow metabolic performance due to low thyroid, even cuts don't want to heal. That's hypo. And then hyper, which is a smaller percentage of the cases, that's where we get all of this. Everything's moving faster. Heart palpitations, anxiety, sweats, night sweats, day sweats, irritability, coarse hair growth, like you said, weird hair pattern growth. That's more hyperthyroidism, jitters all the time, and irritable. And that heat intolerance, they can't handle a lot of heat. Now, everybody has different symptoms. Not one person's going to have all of them. But then, so that's hyper, and then Dr. Kolby, you just let the cat out of the bag with the hypo and hyper. And I just had a case like this. We just finished up a few weeks ago. Was an emergency care nurse, very demanding, saving lives every day. And she said, well, Dr. Harrison, I don't know what's going on. I've been diagnosed with hypothyroidism, Hashimoto's. Hashimoto's, as you said, is just where the immune system decides to mark the thyroid as bad and starts injuring it and chewing away on it. And then what happens is, if you can think of your thyroid as a balloon full of thyroid hormone, it chips away at it and then the hormone can spill. When the hormone spills, you add all this thyroid hormone to the body. So naturally you get into a temporary hyperthyroid state. And then once you burn up that hormone, you go into its natural state before spilling it, and then you go low thyroid. So you have the high and then the low, and the high and the low. And it can be very, very troubling. And then the conventional model is trying to throw medication for hypo and then hyper. So when she told me, she said, Dr. Harrison, I'm kind of both. I'm hyper and hypo, I was told. One time I was told I was hypo, and one time I was told I was hyper. What do I do? that's the exact story that you just mentioned. And so it took a lot of work, but it can go both ways, I guess. Can you kind of elaborate a little bit on that, Dr. Cole?
Yeah, I mean, it's the physiology of it, right? And it can be both. And a lot of times we're just chasing the symptoms, in the traditional medical models is that, they're trying to supplement you with Synthroid or Armor or whatever, based on what your TSH and your thyroid hormone is. The problem with that is that it doesn't take into account everything else. Again, our body is a system. It's not an individual. We try to compartmentalize everything in our society where we go, okay, this is an endocrine problem. Okay, this is a cardiovascular problem. Okay, this is a neurological problem. Well, the issue with the thyroid is that thing goes everywhere.
Yeah.
And it's regulated not only just at the thyroid, but it's regulated in the top of your brain. Your pituitary has a hypothalamic axis that actually stimulates the release of, your hypothalamus stimulates the release of thyroid stimulating hormone from your pituitary gland. So there's all this. It's important to basically note the hierarchy of where the issue with your thyroid can actually be, because in a lot of cases, it's not actually an issue with just your thyroid. So that's the importance of basically what we're going to be talking about next week when we talk about laboratory analysis and the tests that we should order, because you can determine, like, okay, is this a true primary hypothyroidism? Is it a secondary? Is it a tertiary? Where's it at? What's causing it? How do we fix it? What are some easy therapies that we can apply, or medications, or supplements that we can use to treat this? And what are some lifestyle changes that we can make to make this thing more manageable as well?
Yeah, exactly. I think you hit the nail on the head. So for this session, to explain really what the symptoms are of thyroid, what the importance of thyroid is. Yeah, the thyroid isn't hair, skin, nails, energy. The thyroid is so much more than just aesthetics and an inconvenience if it's not running properly. You will have organ shutdown. Your organs will naturally want to shut down if the drill sergeant isn't telling them what to do. So this is about survival, actually. This isn't an optional system. And then I know some people might be listening to this that don't even have a thyroid for surgery, was removed, thyroid cancer, or Hashimoto's, like we talked about, or Graves' disease, where it's completely radiated or it's removed. There are hope for those people as well. There's a lot that can be done, and you can increase the function or the function of your thyroid medication if it's done properly. But as you said, Dr. Kolby, yeah, the thyroid function starts in the brain. It doesn't start in the thyroid. The brain sends a signal. The hypothalamus, part of the brain, sends a signal down to the pituitary, which is at eye level, which is also the brain. And then that signal goes down to the thyroid. And then the thyroid makes the hormones it needs. And the liver and the gut are responsible for converting some of this hormone into a hormone that you can use. So as you said, it's a system. It's not all isolated. If we compared the thyroid system, the thyroid, if we want to compare it in maybe the computer world, the thyroid is just like the computer. It doesn't work unless you plug in the computer and everything else is working, right? And there's somebody on the keyboard that's putting information in it. So the thyroid is just a piece in a chain, a series of events. And next day we'll get into the physiology of breaking this down a little bit more, and diagnosis, laboratory tests, what you can order, lab markers that you can bring to your doctor, and even some resources that you can actually get these tests done. Because the problem is, most thyroid, and I know you get frustrated just like I do, Dr. Kolby, where you get labs coming in and they rule out the thyroid, and only 1, 2, maybe 3 markers are done, but there's actually 12. I think there's 12, or is there 13?
I honestly can't remember unless I'm looking at my
There's
lab
12 for
orders.
sure. There's 12 for sure. I know there's 12. So if you don't have the whole 12 done, you don't know. And then you could be suffering with this when.
And it's like trying to paint a picture or put together a puzzle when you only have some of the pieces, or you only have some of the colors. It's important to know, and a lot of people will truly believe this, and it's not that they don't have hypothyroidism, but if you don't know that they have Hashimoto's, and on top of that, you don't know, so you don't know that they have an autoimmune condition, and you don't know to which component of the thyroid physiology that they have these antibodies to, well, then it ultimately can dictate how well the medication works, how well their system, or how well their symptoms are controlled. I mean, it's really important to have all the information so that you can make a really clear, concise decision, and you can paint the picture with all the colors or put the puzzle together with all the pieces, so that ultimately you can function at the highest level possible. So I think that it's going to be incredibly valid. If you guys are at all interested in this, make sure you tune in next week when we break down the breakdown of the lab tests for the thyroid. It's incredibly useful. You guys can walk in and use it for any one of your primary care physicians can order these tests. Going to be super, super useful. And I'm excited for next week, and I'm excited to see how this can help some people.
Yeah, that's awesome, Dr. Kolby. So I think that's a wrap. If you want to learn more about Dr. Kolby's practice, he focuses in functional neurology, does a lot of functional medicine. Where can they reach you at?
Yeah, so you can get on our website. Our website is www.northlakeschiropractic.com. You can get on Facebook. Our Facebook page is North Lakes Chiropractic and Functional Neurology, or you can give us a call. Our phone number at the clinic is 218-999-7006. What about yourself? How can they get a hold of you?
Probably the best way would just visit the site. You'll learn a little bit more about the thyroid. We're going to jump into it in this podcast in greater detail, but that's www.drgharrison.com. Also known as the Center of Functional Medicine. And there's a lot of resources there, all our contact info, social media, everything. You can learn more about all of this and many other things. But next day is going to be the big drum roll. We're going to dive into it and truly to understand the thyroid. And I know it starts the same in your clinic. Find out what the heck is going on, all the pages to the book, and then get past it and move on and continuously enjoy life. Oh, you still there?
Yeah, sorry about that. Yeah, I can't wait. I'm super excited. This is going to be super, super beneficial for a lot of people out there, and I can't wait. So I'll talk to you next week, my man.
All right. We'll see you later, Dr. Kolby.